Astha Dayal and I am the lead consultant gynecologist with Birla Hospital in Gurgaon. And today we're going to discuss about myths related to PCOS. So the first myth, PCOS can be diagnosed with a test. Now a lot of girls come and ask us that what test can they do for PCOS. The real diagnosis of PCOS can be done with your symptoms. If you have delayed cycles, decreased flow during periods, if you have male hormone symptoms like acne in the jawline or hair growth on the body in a male pattern like facial hair or hair growth on the chest, belly button and hair loss from the scalp, and along with it you have an ultrasound which shows that you have polycystic ovaries, then we diagnose you as PCOS, and it is not just a diagnosis because of a test. The second myth, if you have PCOS, you can't get pregnant. A lot of girls worry that because they have PCOS, they will not be able to get pregnant. Now, this is not true. Although we say that PCOS is one of the commonest reasons for people having fertility issues, but only 30% women who have PCO will probably get a problem in getting pregnant. And if you have mild symptoms, if your hormones are within range, and if you're controlling your PCOS well with your lifestyle modification and medication, and with mild treatments, a lot of girls get pregnant easily and they have a successful pregnancy outcome. The third myth. So if I don't want a pregnancy, I don't have to worry about PCOS. So that's also not true. PCOS is not just important in getting pregnant, but PCO is a complex syndrome which includes the hormones like insulin and androgens, and it also affects your other body functions like your cholesterol levels, diabetes, hypertension, sleep apnea, depression. So if you have PCOS, you still have to control it even if you're not planning for a pregnancy. You still have to get your checks, you have to keep your lifestyle in a better way so that you can keep PCOS in control. Now myth number 4. If you have PCOS, you're obviously going to be fat. Now that is also not true. Majority of the girls who have PCO are overweight, but about 20% girls who have PCO still have it with a normal weight, or sometimes we call them thin PCO. And actually treating those women with a normal weight is tougher, because if you are obese, we tell you to lose weight, your PCO gets better. But if you're already thin or with a normal weight, then we sometimes need to add more medication to control your PCOS. The fifth myth, PCOS can never be cured. Now this actually is partly true, not really a myth. PCOS has two reasons why we get PCOS. One is the genetic reasons, that means we have inherited a genetic tendency because of which we have that hormonal imbalance. The other reason are your lifestyle factors. So you can control your lifestyle factors if you have a good diet, if you are controlling the high glycemic carbs, if you're cutting down on sweets, on maida, on junk food, biscuits, breads, bakery items, pizza, burger, pasta, noodles, naan, cold drinks, juices, and also cutting down on rice and potatoes. So all these foods release sugar in your body very fast. So if you switch to complex carbohydrates in your diet, if you exercise regularly, and that exercise should include a little bit of cardio also, if you maintain a healthy weight, if you have a good sleep hygiene, if you have a proper 6 to 8 hours sleep at night, and if you're managing your stress in a good way, all these lifestyle factors will help you control PCOS. But you can never get rid of the genetic tendency. So if your lifestyle goes bad, then the PCOS may come back again. Also with increasing age, with some stress in your life, it could come back again. And it could still lead to the consequences which happen on later in your life, like diabetes, hypertension, cholesterol. So you still have to keep checking for these factors, and you still have to keep a good control on your lifestyle. So PCOS cannot be totally removed from your body, but yes, it can be controlled in a very good way so that you don't need any medication lifelong. Thank you.